So, welcome back. Today, we're talking about the importance of time when it comes to stroke recovery, especially within that first 3 months or that first 90 days. This is actually what is called a critical window, and it's when the brain's potential for neuroplasticity is the highest. It's a fancy way of saying that the brain is ready to rewire itself and it's ready to heal. And it's usually within that first 90 days. Now, this doesn't mean that after the first 90 days, nothing can happen. The brain can still continue to improve, pathways can still be made. It's just easier within that first 90 days. And I remember after my own stroke, as a doctor on the inside, I was always talking to myself because I was in doctor mode. I was trying to problem solve, etc. But I couldn't speak very well on the outside. And if I did speak, it was very garbled. So people really didn't understand what I was saying. And fun fact, I actually sound like Deadpool on the inside, but without the bad words. And I remember saying things to myself like, we are not in Kansas anymore, or we have to figure out how to MacGyver our way back to where we were, etc. And one of the big ways I did this was by not wasting a second of that first 90 days. And I remember being in the rehab room and seeing other stroke survivors there as well. And there didn't seem to be that same level of urgency that I had as a physician, because I was taking advantage of every rehab opportunity and I was trying to cement those pathways. And when I looked around me, I felt that other patients were almost giving up too easily, or after an hour or so of rehab, they would be, I'm too tired, I have to go back to my room and rest, etc. Whereas I was taking advantage of the 7 hours a day, almost 7 days a week, almost 6 days a week of rehab when I was in inpatient rehab, and then another 2 months at home. And whatever I learned that day, I would try to cement it that night, meaning that I remember, for example, I had a lot of difficulty making left turns. I would lose my balance, I would kind of fall to the side. And so in rehab, when they taught me how to do that, then that night in my room, I would make really tight circles, like left-handed circles, to kind of cement that rewiring that my brain was having, to help it out a little bit. And this I would do no matter how tired I was or in how much pain I was. And because I knew I had to be so focused and I could not afford to be distracted, I actually did not allow any visitors that first 90 days after I had my stroke, other than immediate family members and two doctor friends. You know who you are. They were allowed to visit me, but no one else, because I had to stay focused. And one of the important things that can happen in some patients after their stroke is that they can lose the urge to empty their bladder. And this is actually very important, and it happens within the first few days, and it's a little bit time sensitive. But to understand how important it is, you kind of have to understand how the body is laid out on the inside. So the human body, we each have two kidneys. And what that kidney does is that it's about the size of a fist. We have two of them, and it will filter all the blood in the body every few minutes. And in addition to cleaning the blood out, it actually balances it perfectly so that the rest of the body can use it. And the kidney will keep what it needs and it will let go what it doesn't need by making urine. And so the kidney will make the urine, and that urine will travel down a small tube into a muscular sac called the bladder. And because we have two kidneys, we have two little tubes that will enter the bladder. And then the bladder, as it collects with urine, it will start to stretch a little bit. And once it stretches, it'll send a signal to the back of the brain saying, hey, I need to empty out. And the back of the brain will actually send a signal to the front of the brain and ask, is it okay? Meaning that, is there a toilet nearby? Can we empty out the bladder? The brain will figure out the logistics, the front of the brain, and it will send a signal to the back of the brain saying, yes, we're good to go. And then the back of the brain will send a final signal back to the bladder to kind of contract or to squeeze out the urine at that time. Now, I remember when I was a medical student, what my superiors had taught me when we were taking care of patients who had lost this urge or had lost this connection between the bladder and the brain, that the bladder can stretch. It can stretch out quite a bit, but once it stretches beyond about 450 cc's over and over again, it can't really shrink back down to its original size. And when that happens, a little bit of urine can actually build up in the bladder over time, and then that urine gets very easily infected. So it causes more problems for the patient. And I got around this issue by forcing myself to go to the restroom every 15 minutes. And I want to say I did this for about the first 3 days after I was able to, for my stroke. And within 3 days, I got that urge back. So, in summary, as a doctor, for the first few days after my stroke, what I was really, really focused on was not wasting a minute, learning as much as I could in rehab and making sure, I didn't back out of anything if I didn't have to. And then the next thing I would do is really cement those pathways. So whatever I was learning that day, I would try to repeat over and over at nighttime. But also when I got home, I would repeat those same exercises to I knew my brain was rewiring to kind of cement those pathways. And then the other thing that I did was I was really focused in those first few days on waking up that connection between the bladder and the brain, because I knew as time went on, it would be harder for that connection to recover, and it could cause some permanent damage to the bladder and give me more infections down the line, and hence, lower my ability to survive the stroke or to recover from the stroke. Now, I completely understand that this method that I use, because I did this no matter how much pain I was in or how tired I was, and I completely understand that this method is not for everyone, but I'm hoping it will give other stroke survivors some ideas to help them with their own recovery. As Jedi Master Yoda would say, your path, you must decide. Until next time.